Get your coronavirus questions answered.
Dr. Zorba Paster is standing by at his office in Oregon. The number to call is 270-9933. And we're going to take the first caller right now, Georgia from Poinet. Georgia, hi, can you hear me?
Hi.
Hi, what's your question for Dr. Paster?
Well, I'd like first to say hi, Dr. Zorba. My question is to do with the coronavirus shot. And I understand if you have antibodies in your system, that they can cause more severe side effects if you get the shot.
Good question. The answer is no, that's false information. We don't check people for antibodies to see whether or not they had coronavirus before. And although that's going around the internet, you should be checked for antibodies before you get the shot. The answer is no. Side effect profile is not going to be any different whether or not you had coronavirus before or not. And even if you had coronavirus, get immunized when it's offered.
All right, let's go to Barb in Portage. Hi, Barb, what's your question?
Yes. Dr. Paster, I called before and I've been trying to get you. I've been trying to get the shot, and every place I go or call, they say that I can't get it because of my age, and I'm trying to figure out where I can get it. Do you have any answers?
Well, you know, first of all, in most cases, you certainly can get it if you're if you're 75 years of age or older. Most clinics are giving the shot. Now, some are beginning to give it to 65 and older, following the recommendations right now by the CDC. But if you don't get it at one clinic, call another clinic, call your public health department. I heard, for instance, around Madison that the Greene County Public Health Department, sometime early next week on Monday or Tuesday, is going to begin to give shots for people who live in Greene County, and they're going to give it to people either generally 65 or 75 and older. Call your county health department. Keep on calling around. I know it's frustrating. It is frustrating, but keep on calling and find out. 75 and older or 65 and older. Other 65, no, you're not going to get the shot right now.
All right, we have Harold from Edgerton. Hi, Harold. What's your question?
Hi, Dr. Zorba. I had cancer and I have no spleen whatsoever, so I have no immune system. I've had no adverse reactions to pneumococcal or the flu. Is the shot going to be okay for me?
Well, the answer is yes, and you do have an immune system. The immune system is in your bone marrow. You just don't have a spleen.
Excellent.
If you didn't have an immune system, you'd be dead. You wouldn't be around. But that's the answer. And just like anyone with a splenectomy has to get the pneumonia shot because they're much more likely when they get pneumonia to get sick, anyone with a splenectomy is much more likely to get sick from COVID. But once again, it's 75 and older in some parts of the state and 65 and older in other parts.
All right. Thanks for calling, Harold. Let's go to Vicki in Janesville. Hi, Vicki.
Hi. I have two questions. One is they used to say after the health workers, the nursing homes and everything, it was people with high-risk conditions, and now they're going strictly by age. And I'm like 5 months short of being 65 with risky health conditions. And so there's no way that I can have the shot, right?
That's right. And in fact, I'm not sure what they said, but the CDC actually said we're doing it by age. We're not doing it by conditions because we really don't know how to actually end up scoring those conditions. We know age is the biggest factor. Now, as far as the nursing homes and assisted living, they're in a whole other realm by themselves. CVS and Walgreens and local pharmacies are taking care of them, and they're a totally different system, not competitive, but a lot of immunizations are standing by for those people because they are actually the highest risk of death. 1% of the population are in nursing homes and assisted living, and they're responsible for 40% of the deaths nationwide.
We have time for one more question. Renee from Madison. Hi, Renee. What's your question?
Hi. My daughter and her family, they all had COVID 3 months ago, and I'm wondering if it's safe for me to visit them, masking up and Just wondering if I can spend more time with them.
Well, first of all, the reality is you still have to be more than 6 feet apart. Better to do it outdoors than indoors. You have to follow the usual precautions, whether they've had COVID or not. Your question is whether or not, since they had COVID, can they spread it to you? And the answer is maybe. And according to what we know from the United Kingdom, about 17% of the people who have had COVID actually can carry COVID in their nose. So the answer is having COVID does not protect you from not having COVID in your nostril, sneezing, and spreading it to you.
Thank you so much.
All right, thanks for calling. Thank you all for calling. Zorba, we're out of time. We'll see you next Thursday.
Take care.
All right, we'll have a final check of your forecast coming up.